Hello again, everyone. It's Adam Caplan here for Inside the Birds in our Chalk Talk series. And we wanted to bring him back with his partner, Evan Kraft, but Evan's not available. But Aaron Borgmann is. Aaron, good to see you, my friend.
Hey, Adam. Thanks for having me this evening.
So, Aaron, if folks don't remember, he's a former NFL physical therapist and athletic trainer. You might remember him when he worked for the Eagles. Then he left the Eagles when Andy left, and he went over to the Chiefs. Aaron left the Chiefs to start his own rehab center, Borgman Rehab Solutions. They started the Sports Med Bros podcast, and I got to ask you, Aaron. Typically guys like yourself, they don't get into broadcasting. What was the motivation to do it?
Well, I think if you ask anybody that knows me, especially my wife, she'll tell you how much I like to talk about things. And I'm very passionate about, how sports injuries are taken care of, especially in football. And so I had been pestering Evan for years about this while he was still working in the league
Ah,
and I was out. And then we said, are we going to ever do this? Are we going to do this? Are we going to do this? And he finally got out. And so then we just started it right up. And, I would call it niche of niche, Adam, because not everybody wants to know the nuts and bolts of football injuries. But we love doing it. We love talking about random things. We're not on there every day talking about, the normal everyday stuff. We try to pick and choose some odd things, that you don't see very often, some of which we're going to talk about this evening. But we were having a great time with it. Thanks so much for the shout out.
now you could find their pod on X at sports underscore med underscore bros. And Aaron, what's your Twitter or your X? I'm sorry, your X.
My ex is Rehab All Star. We're also all over on Instagram and
Good.
same handle, same name, nothing crazy.
Gotcha, gotcha. So before we get started, tell us about Rehab Solutions.
Yeah, so I started the business really not knowing what I was doing 7.5 years ago. I had never taken a business class, but I decided that I was going to bring NFL level sports medicine care to the masses, or at least to the masses here. But I also travel quite a bit. I lecture quite a bit. I advise. I consult. So I'm kind of a mercenary these days. I don't. I'm like 100% mobile, except for the time now where I'm kind of moonlighting in a country club here and there for some golf stuff that I like to take care of. But really a jack of all trades these days. But still take in quite a bit of football just because you can't really turn that kind of stuff off.
So the midfoot sprain, I learned about the Liz Frank injury, believe this or not, when Deuce Staley had it. I'd never
Yep.
heard of it. So let's talk about your interpretation of just that type of injury and what's the rehab like for a midfoot sprain?
Yeah, so just a real quick history, just to give people some background about where this is. This is right in the middle of your foot, right around between where your first and second foot bones meet. There's a joint there called your Liz Frank joint. It got its name from a French field surgeon back in the day, if you can believe it or not. His name was Liz Frank. What happened was people would get caught in horses and get drug, and they would have to amputate at that joint because their foot would get caught in the stirrup. So it then became known as the Liz Frank joint. So, putting that aside, what it is, it's a pretty stable joint most of the time, but when you get a sprain there, and a sprain being defined as a disruption of your ligamentous structures, it's not a muscular thing; it's a ligament thing, much like an ACL, but just in your foot, on between a couple of tiny little bones there. They measure the width of the spreading of the joint, and I don't want to pin myself here in a corner, but they do so under X-ray, under weighted X-ray, and it depends on how wide that joint is to whether or not this becomes a surgical consideration. And some players can play with it to a certain degree, depending upon position. Some players struggle with it because it really is one of the two arches of your foot. Everybody knows you have one longitudinal arch, but you also have a latitudinal arch. It's helps compose those arch. That's kind of where they meet almost. And so if you have some instability there, it's really, really tough for anybody athletically to do anything, let alone plant, cut, pivot, things of that nature. Now, when it comes to the rehab of said joint, if you're
Yes.
not going to do a surgical procedure, which some players do elect not to do, depending upon, again, the spreading of said joint based upon doctor's recommendations, it's a lot of what we call intrinsic footwork, meaning the small muscles of your foot, the stuff on the bottom, the things that kind of help steady you during balance, your toe flexors, your toe extensors, your grabbers, the things that you feel in
Hmm.
your arch. And a lot of single leg balance, getting good at that again, because what you're trying to do is you're trying to get strong enough to overcome the sprain of that joint. Now, because you can't fix the ligament, it might scar in a little bit, but you're not going to ever close that space down again unless there's a surgical procedure, right?
Mm.
So, anybody that has a non-surgical strategy for this has to get super, super strong. They have to get really, really stable, and you can do some of that, not all of it, but some of that with some kind of more heavy taping techniques, a lot of orthotic work, different, actually, believe it or not, some different shoe tying techniques are
Yep.
known to help it a little bit.
Shoe
So
tying.
yeah,
Wow.
there's different ways to tie your shoes to help this out. I know we're going to talk about an offensive lineman here in a
Yeah.
second regarding it, but one of my last big rehabs
Lane
in,
Johnson. Yeah.
in my time in the NFL was with an
Yeah.
offensive lineman where he was kind of on that borderline on whether or not he wanted to have surgery or not. He elected the non-surgical route. We rehabbed for 5 or 6 weeks. He played a couple games, decided he couldn't do it. It just wasn't effective. He was
Mm.
hurting the team,
Oh,
then went and had surgery. And now he went on to have a wonderful career afterwards. So it's not a death sentence or anything like that.
sure.
But it's kind of when you're in these gray areas, you really have to parse out whether or not, it's a surgical consideration.
Aaron, your wonder with Lane Johnson, and I know that he's a warrior, he's tough, he comes back from injuries, but you gave such a great description. We can't rule out as much as you talked about of the treatment and things you can do to be able to play with it. It doesn't guarantee you, as Aaron just said, that it's going to work.
Yeah, and one more consideration that I'd give to this particular player, Adam, is that I believe it's his right foot, correct?
Yes.
And for a right tackle, that's a big deal because your foot is externally rotated and you're always planting back on it every time you take a pass set. So it's a little bit different outside versus inside foot. There's a dynamic there that not a lot of people would, kind of parse out and understand that actually does matter for this particular player.
Now this one is also interesting because in our reporting, Jalen Carter had shoulder problems back at Georgia. That, in addition to the off the field concerns, but our understanding was he didn't have surgery. There's some sort of procedure.
Yeah.
What could it be? Injections?
Yeah. So first of all, when I first saw the report, I was very, you know, like what in the world are we dealing with here because it's bilateral. You just don't see bilateral injuries acutely. Like that just doesn't happen in most people. And so read a little bit more about the situation, heard about the fact that he had had some issues coming out and whatnot. There I actually had some discussions with it on Twitter with some very notable sports medicine people that people
Ah,
can go back and look at.
okay.
Listen, the consensus is that this player had some sort of injection of some type. Now, that could mean something called a platelet-rich plasma injection or PRP. That could mean probably less likely a stem cell injection. Whatever it might be, becomes, I saw somebody, national pundit, even use the term therapeutic intervention, which is just fancy speak for he had something done, right? Listen, if it's a PRP injection, back in my day when we were doing these things, players didn't really get those inside a joint and they didn't miss much time with that. That has become more in vogue now. So, if you're throwing darts at a dartboard, you got to think that that's probably the leading candidate in the clubhouse. But other things like a stem cell injection or a cortisone injection in either side are also possibilities. That being said, if it's not surgery and he's week to week, obviously, you're thinking like it's something injectable or biologic or
Yeah.
some medicine to kind of calm things down. I think the timing is kind of interesting that it must have been so much that a week off of practice or limited practice wasn't going to help. So they
Right.
decided to shut the kid down for some amount of time, whatever that was. That being said, it seems like he's going to be back sooner than later because of this, as opposed to a full blown procedure, if that makes
All
any
right.
sense.
Yes. So here's the two questions off of that. Cortisone, I've talked to players who've had it. It generally, what you know better than me, obviously, but it could definitely work and make you feel better. But how soon, if it was cortisone, how quickly could you come back from that?
Yeah, so cortisone injections, if it's you or I getting a cortisone injection, I tell my patients all the time, we generally don't even expect cortisone injections to work for 10 days to 2 weeks to
Hmm.
really truly kick in. The immediate relief that you feel after the injection is more from the numbing than the actual medicine itself. That being said, activity is not really prohibited, but more like contraindicated. We tell people to take it easy for a couple days. And a professional athlete, it's not a whole lot different. You don't really do a cortisone injection in a professional athlete thinking that it's going to be helpful in 1 week.
Sure,
You would do that
sure.
thinking it's a long-term thing. So maybe he takes a week off, maybe everything kind of calms down, and then the stretch run, you really see the benefit of that cortisone injection.
Sure.
Perhaps that's what the team's thinking. If it's, if that's truly what it was, because guess what? If he comes back next week, that cortisone really hasn't kicked in or done its job just yet.
Takes longer.
Yeah.
Okay. How about PRP? How long will that take?
Uh, PRP, platelet
Yes.
rich plasma, for those that don't know, is just really your own blood, and they spin it down and they take all the heavy things, the cells in it, and they inject it back in almost like a clot. And it's supposed to help, with tissue healing. Some people think it helps mitigate inflammation, things of that nature. There's less good data on it inside a joint as opposed to a tendon or a muscle. PRP is one of those things that helps some of the people some of the time for some things, right? And so, again, that would be more of a longer term solution as opposed to a week to week solution. However, once again, if you're shutting this kid down for a week and letting him rest, you're getting some benefit more so from that rest, and then probably doing the injection, as a adjunct long term, no matter what the injection is.